All right, Lauren, so your dad's called the ambulance today because you've had a seizure. Is that right?
I think so. I do have seizures.
You do have seizures, yeah. So you normally have epilepsy?
Yeah.
Okay. So I'm just going to ask you some questions just to make sure that you've recovered to how you normally would feel after a seizure, because I mean obviously your dad's called the ambulance today for a reason, so we just want to figure out, make sure that everything's okay before we either decide if we're going to take you to hospital or leave you at home. Is it all right?
Yep.
Okay, great. So I'm just going to give you 3 words to remember, and I'll ask you in a minute if you can remember them, and just tell me what they are, and ask you a few more questions, okay?
Here I'll be using the Potomi mnemonic to assess this patient's mental status, as she has an intellectual disability. I'll be asking her some questions to assess her intellect and insight, memory and orientation, and during the entire assessment I will be assessing her behaviour, affect appearance and mood, and thought and talk.
So can you remember for me unicorns, sunflowers and kittens? Okay, so 3 things for you to remember.
Yep.
All right. Now, do you know what day it is today?
I think it's Wednesday.
I think it's Wednesday. Yep, it is Wednesday. Good job. And do you remember what you had for dinner last night?
Roast, I think.
Roast. Dad, is that correct?
Throughout the assessment, you will hear me asking the patient's father to confirm whether the patient is answering my questions relative to her normal level of cognitive ability.
Yep, awesome. Do you know who our Prime Minister is?
Yeah, it's that chick, that lady. Can't remember her name. She's got like the big teeth.
Okay, yeah. So Dad, would Lauren normally be able to recall the name, or would it more just be a recognition of the face?
More recognition of the face.
Okay, yep. And that's completely normal for her with her intellectual disability?
Yep.
Yep. Okay, fantastic. Lauren, do you remember what those 3 words were that I asked you to remember?
I think one was a cat, because I like cats.
Mm-hmm.
But
No? Okay. Dad, is that normal for Lauren? Would she be able to remember words if I asked her them again a few minutes later?
Yeah.
Yep. Okay, cool. So you remembered one of them, so that was great. Good
Yeah.
job. One of them was kitten. Yep. The other one was a unicorn and sunflower.
Oh,
But
yeah.
that's okay.
Yeah.
Well, you tried your best. That's all right.
I was never a cat because I like cats.
Yeah, that's cool. That's okay.
Don't really like sunflowers. So.
I will use the non-transport checklist for seizure to make sure that the patient meets our requirements to stay at home.
So, did you got any pain anywhere? Do you think you hurt yourself when you had your seizure? No. Okay. All right. And so obviously you're here with your dad. So you've got someone who's safe to look after you.
Yep.
And did you give Lauren any medication for a seizure?
No.
No. Okay. Cool. And neither have we. So that's awesome.
I don't think they last very long.
No.
Nah.
Okay.
No.
Okay.
No.
Great.
A lot.
And we've established that you have epilepsy. So is this seizure today out of the ordinary for you? Does it follow your normal seizure pattern?
I think so. Yeah, I do have them a lot.
Okay.
And I just take pills every day.
Okay.
And
Dad,
sometimes they work, sometimes they don't.
Okay. So Dad, can you confirm that it's within a normal seizure pattern?
Yeah.
Fantastic. All right. So Lauren, I think that today it will be okay to leave you at home. I don't think you need to go to the hospital. So our checklists and questions that we've asked to assess you, your dad's confirmed with me that you're back to your normal level of how you would be if you hadn't had a seizure. And we'd just like you to go and see your doctor within the next 72 hours, okay?
Yeah. Do I have to tell them like the sunflower and the cat thing as well?
No, you don't have to tell them that. That's okay. Well, I'll do some paperwork and we'll send through the paperwork to the GP so they're going to know what's happened. And so you don't have to worry about telling them too much, but just you might need a wee review of your medication or something, because you said sometimes they work and sometimes they don't. So,
Yeah. I think Dad takes me to the doctor a lot for that.
Okay.
Yeah.
That's great. Fantastic. All right. So if you're happy, Dad, are you happy with that?
Yep.
Fantastic. Okay. Cool.
Fortunately, in this instance, the patient has returned back to her normal level of cognition and meets the seizure non-transport checklist, so she is able to stay at home. However, in the instance that she did need transport and was refusing, because the patient is unable to accurately remember information and understand information as per her intellectual disability, she would not be able to make that decision to stay at home against medical advice.